Welcome to Iowa State University. My name is Mattie, and it is my job to give you a tour of the College of Veterinary Medicine. Let's go. Here we are in the Large Animal Hospital, a state-of-the-art hospital that allows us to work with many different types of large animals. Our Large Animal Hospital, which opened in 2008, offers advanced diagnostics including endoscopy, ultrasound, cardiology, advanced imaging including CT and MRI, and complete blood work. And we love having this large animal hospital because it is so spacious and because it is such a great learning tool for all students. Interestingly enough, as we walk through this large animal hospital, we can see that some of the surgical ORs are created in a similar way to how you would imagine a human OR would be, where the surgeons will scrub in at this sink here, and then you would be able to walk into one of the two ORs depending on the procedure that you'll be working on. Here we can see where the large animals can be brought into the hospital for processing. We can also see different ways of storing the animals here while they're being treated for whatever ailment they have. One of the greatest parts of this new hospital expansion is the ability to have much more space for the students and for the clinicians to work and learn in. We used to have 9 exam rooms and we have now expanded to 22. Because Iowa State has a specialty clinic here, we offer many different services, such as rehabilitation, cardiology, dentistry, dermatology, internal medicine, oncology, ophthalmology, orthopedic surgery, reproduction, soft tissue surgery, and zoologic medicine. One of the most amazing new additions to our hospital is the rehabilitation facility. This allows us to take patients that we have seen either in surgery or through emergency services, and we are going to help rehabilitate them just like we would in human medicine. One of the greatest tools that's available to our students in this hospital is our clinical skills lab. One of the most amazing parts of having this clinical skills lab available to us is the ability to practice our basic skills and also some of our more advanced skills without the need to use live animals. Welcome to the Gross Anatomy Lab. This is where most of the first-year students will spend all of their time. During Gross Anatomy Lab, students will spend time working with cadavers. During the first semester in Gross Anatomy Lab, students will focus on cats and dogs. During the second semester of Gross Anatomy Lab, students will focus on horses, cows, pigs, and goats. The junior surgery program is new to our third-year veterinary students. Junior surgery lab prepares us for the inevitable in our daily lives as veterinarians, spays and neuters. We collaborate with a community outreach program so that we learn our basic surgical skills while also combining it with the ability to work with live animals that will then be adopted out to families. We also have the ability to treat our patients as though they are truly a full-time patient. We do workups from the beginning of their entrance into the hospital to the day that they are discharged as healthy patients in the hope of finding their forever homes. Of course, being a veterinary student, we spend the majority of our first 2 years in the classroom. Luckily at Iowa State, we have cutting-edge technologies in all of our classrooms. Classes are even recorded, allowing students to stream these lectures online. We also offer integrative lab space, which allows us to have classroom time working with other students in groups. I'd like you to look at the Gentle Doctor statue. This statue was created by Christian Petersen, a Danish sculptor who decided to depict what veterinary medicine means. And he made a statue that is of heroic proportions. The statue is over 7 feet tall. He also has very wide feet and large hands, which depicts what we do as veterinarians every single day, our hands being one of our most important diagnostic tools. You can see that the Gentle Doctor is holding onto his patient, which happens to be the puppy. However, you can also see that his eye contact is being held with the mother dog at his side. This is to really depict how the veterinarian goes about all of our medicine. We look at the whole picture. We want to make sure that we're seeing all of the details, whether or not that's the patient in our arms or the medicine of the mother as well. Thank you for joining us today. I hope you enjoyed the tour, and we look forward to seeing you at the College of Veterinary Medicine soon.